My name is Carly Domino, and this is my Who Am I Now presentation. By going through CBU's nursing program, I have decided I want to start my nursing career in mental health. Psychology has always been a topic of interest for me, and learning more about a nurse's role in mental health, I figured out this is the area I want to be in. Additionally, through the nursing program, I have learned how to critically think in clinical settings, learn the importance of planning and being organized, and how to care for others with different backgrounds and cultures than mine. I am also now not afraid to attempt things I'm not comfortable with in order to learn. Mark 12, verse 31 says, "You shall love your neighbor as yourself. There is no other greater commandment than these." This relates to the nursing career because I believe in order to be a good nurse, you should have a certain love and care for other human beings. Loving others and seeing them as valuable will translate into a nurse giving the best care they can provide. Adding on to that, Timothy 5 verses 1 and 2 say, "Do not rebuke an older man harshly, but exhort him as if he were your father. Treat younger men as brothers, older women as mothers, and younger women as sisters, with absolute purity." In nursing, there will be difficult patients or days where I don't want to be there, but I should remember to treat my patients like people I care about or how I would want someone else to treat my loved one, because we are all deserving of good treatment no matter what. The first Parsi concept I chose is reverence, which is defined as regard for profoundness of presence, shown with acknowledgement of uniqueness of each individual. I chose reverence because I think it connects well with empathy and also with caring for a patient. As nurses, we'll have to be empathetic towards all of our patients, and to do that, we must realize that all of our patients are unique, with different experiences and qualities that makes them them. We're going to have patients who will be in the same position and have the same diagnosis, but we can't automatically assume that because one patient feels this way, that a person with the same diagnosis will feel the same. We have to see each and every one of our patients as unique individuals and care for them that way. I think reverence leads to having care that is truly patient-centered. The second Parsi concept I chose is freedom, which can be defined as contextually construed liberation. It is the foundation of all essences, the stuff of being. I think as nurses, acknowledging freedom connects to being open-minded and non-judgmental. Ultimately, our patients are in control of their own lives, and they have the freedom to choose to do whatever they want, regardless of what we as nurses think. They have the freedom to refuse treatment and the freedom to choose their own lifestyle, culture, etc. It is our job as nurses to care for the patient and keep our personal opinions out of the equation. We must be empathetic and understanding. We too have freedom to choose, and we should choose to see our patients as valuable and important no matter what. My most important takeaways from nursing school that I will carry into my nursing career are being an active listener and an advocate for my patients, and viewing my patients in a holistic manner. I want to make sure all of my patients feel heard and be their voice when they need it. Additionally, I want to look at all my patients with their physical, emotional, social, and spiritual needs in mind. My definition of what it means to be a nurse is being caring, trustworthy, empathetic, compassionate, and knowledgeable. Nurses care for people when they are their most vulnerable and scared, so being a nurse means doing your very best to provide the best care possible for every patient.